Dee, Eric, Michael, thanks again. Now, while the budget was the focus of the session, the governor called for a few other items to be heard, and by a few I mean a lot. Some came right out of the gate with the so-called rocket docket. She worked with the legislative leadership on that before session even started. Maybe the most high-profile proposal within that was House Bill 9. That was the Immigrant Safety Act. The last segment we covered it, and we covered it earlier in the session too. It's going to require Torrance, Siebel, and Otero counties to end their contracts with ICE to detain immigrants. Eric, do you have any sense of when those contracts will end and what it'll look like when they do?
I think that what the legislation says is, they have to do it as soon as possible, as soon as they can contractually get out of it, right? And I think, there's a lot of scrambling going on to say, like, what there's people working there, what do you do with the facilities? The Trump administration is already threatening all sorts of, reactions, not just for those places. Actually, they're not even for those places. It's for the state, I think, and it remains to be seen exactly how we're going to be pounded. But I think it was a huge moment for a state that has the history we do to really, with a speaker who's very much an immigrant American. He was born here, but he's very proud of his immigrant heritage, and to say, look, we're just, whatever's happening in Washington, whatever the circus is, whatever's happening in Minneapolis, we're going to put a stake in the ground that we're just not going to be complicit. And I think we're going to probably pay a price in terms of the politics for this. Mm-hmm. But I do think these communities, we have to say to them, like, if we're going to do the right thing as a state, that we have to have a plan for how we get to the next thing. We talked about economic development, but also as a matter of policy as a state, we shouldn't relegate these facilities to sort of certain parts of the state. I think the win here is that New Mexico is leading on a really direct pushback on really terrible policy. And if not us, then who, right? New Mexico, a state that's a majority minority state, but also a state that has a long tradition of being pro-immigrant, being heavily interested in diversity, and it's one of our strengths. And I'm just really proud that the legislature and the governor have said this is an early priority. We're going to make it happen, and we're going to do whatever we need to do to help these communities adjust.
Yeah, the legislators that we spoke to, the governor, they've all outlined pretty close that this is step one. To your point, we just need to get this done, and then we'll go from there. But kind of the from there is a bit of a question mark. We spoke with the governor, and she acknowledged that since private prisons can still contract directly with ICE, this might not do much in terms of the detention part of it. It gets the state out of the equation, but there's a good chance that immigrants might stay in these prisons. But she said that if they need to do more, they would. So, Michael, what could more look like? What should more look like?
Well, first of all, let me just say, for me, and I would hope most people of conscience would look at this. This is a moral question. It's more than just a legal question or it's a legality of some sort. It is a moral question of how we view each other's, how we treat each other's, how we honor each other's. And so I'm really happy, I'm gratified that the state of New Mexico has taken this position, because there are many states and localities that have not. They've embraced it, and I guess for a little phrase that comes from the Indian community and out of Minnesota, who's in the midst of a horrific occupation. No one, and they've come to say, no one is illegal on stolen land. Mm-hmm. So I'm happy. What we need is another Pueblo revolt on a national level, because that altered the course of New Mexico history in significant ways, and maybe there's some lessons from history that we need to study.
Undoubtedly. Now, Dee, next up in the rocket docket, big chunk of money, $1.5 billion road bonds package. We spoke with Republican Senator Steve Lanier. He called New Mexico one big pothole on last week's show. Who's set to benefit from this huge infusion, and who gets to decide who gets a share?
Well, I think there is a list of projects, and I've already heard complaints that from various legislators that there's not enough going to southeast New Mexico, for example. But, road and road bonds, road funding is a bipartisan issue. There's a pothole in every district, like a turkey in every, or a chicken in every pot. There's a pothole in every district. So, we have had a problem, because roads are funded through the gas tax, and we haven't raised the gas tax in years. And this is the road fund is separate from the general fund too, right. And so it's running out of money, and especially with electric vehicles and gas. Cars that are no longer gas guzzlers, although I hear that's about to change with federal regulations being dropped. Everybody seems to support the bonds, and they're always kind of a no-brainer. It's just, is there one in my district?
Right. I mean, it sounds like a lot of money, but it's a drop in the bucket in terms of the need, right? I think the number is $7 or $8 billion that really would in need in terms of these roads. Some of the roads in the state you can't, especially all over the state, but certainly in oil country, like they have a legitimate claim. Like if you try getting around in Carlsbad and some of these southeastern counties, they really need. And the real numbers from like $7 or $8 billion. So this is like phase one. I think we're going to have to invest a lot more.
Okay. Now, one of the last of the three bills, or the last of the three bills to be pushed through at the beginning of session, was the Interstate Physicians Compact. As of now, we're only part of the Nurses Compact. With this Physicians Compact passed, we're expecting the governor to sign it. So, Michael, these compacts, they allow doctors who are licensed in other states who join these compacts to come into New Mexico and practice. That said, there are a whole bunch of other issues keeping doctors out of the state. Will this alone have a tangible impact?
I would have to believe that at least it's a step in the right direction and exploring the potential opportunities with this. The only other experience I could draw on is my 20 years with the Indian Health Service, where Indian physicians, not just Indian physicians, but physicians were able to come to New Mexico, either if they were with the U.S. Public Health Service or if they had been in private practice, to come to New Mexico and practice in our facilities. And maybe there's some lessons to be learned from the Indian Health Service and how it's managed and handled this topic and this issue. I'd have to defer maybe to them.
Okay, sure.
I think what it is, it's really expedited licensing for doctors, and we also passed one for social workers. So we do, and we need that. It will facilitate telehealth also, and I think that's important. I think it will really benefit people on the borders of New Mexico. But remember, this goes two ways. Doctors can leave the state, too. Doctors can practice in Texas or in Colorado or in other places where we have reciprocity.
Sure. Yeah, there's a lot of talk about this being a big boon for the ending the doctor shortage. But we also spoke with Republican Senator Nicole Tobiasen early on in this session, and she basically said it's going to be useless unless we have Med-Mal reform. Well, now we have Med-Mal reform with House Bill 99. What ended up getting to the governor's desk, Eric?
I think this is the big story of the session, right? I mean, this was a gargantuan fight in terms of the interests involved. The healthcare providers, big hospitals, obviously patients' rights groups, and this very powerful, trial lawyers who really were arguing that we need to protect patients, right? So there's some politics there. What ended up going to making the desk is by the way, I was dead wrong. I told somebody at UNM that there's no way they're going to get a clean bill out of that Senate Judiciary Committee when you have key leaders who are, we won't talk about that, but the fact that a powerful chair is in the business of sort of making sure, to put it how he would put it, protecting patients. They amended it, really damaged it. It came out sort of limping out of the Judiciary Committee, eliminating some of the caps that they needed to really make this whole overall mosaic of compacts and change and malpractice reform, other things. And then it got to the Senate floor, and surprisingly, overwhelmingly, those amendments were stripped out of it. So it's essentially a clean bill. What it essentially it caps some of the most problematic provisions of our malpractice statutes, which was really, especially punitive damages was the big thing, right? Yeah. Punitive damages which was really. I'm not sure I believe that the insurance companies were as the honest brokers here. Hey, we're just charging what it costs us to cover these physicians. I think they kind of got off scot-free. Nobody really criticized them, so why are the premiums so high? But essentially what it does is it eliminates, and I think providers are going to really have to sort of put their money where their mouth is. Now that these sort of really damaging legal constraints around how much exposure they have in terms of these legal cases. Now, if they're gone, really what should be the case is we should really see a lot more physicians coming. We should see physicians staying. We should see physicians really healthcare access increasing.
Do you expect that to happen? And do you expect insurance companies to follow?
Well, I hope that there's some pressure on the insurance companies, and I do think they got a. Well, we have a state superintendent of insurance whose job it is to sort of regulate the insurers, and I also think, I'm not saying they're not doing the job. I think they did. Of anybody who sort of got a free pass on this, why is it that these premiums are so outrageous, right? So for sure we needed some reform there, and these compacts are going to help. I'll just give you a real life story. I have an eye condition I was trying to see a specialist for. I called, and I was a previous patient. 1 year waiting. There's a 1 year wait on it. I thought, geez, it's not even life or death thing, but for folks who are trying to see neurologists or some really, so we have a real problem. And by the way, I don't think it's any of these. This med malpractice is not going to save the day. Compacts alone aren't going to do it. We have a lot of things we have to fix in our healthcare system.
It's a complex issue that is going to take really not just focusing on the narrow aspect of it, but the larger aspect. One of the things that comes to mind, and I have no experience with the University of New Mexico's med school, but we have a medical school here. Who are they training? Where do they come from? And how many of them actually make a choice to practice here in New Mexico? And or is it possible to give some sort of preference to people who are from New Mexico, Native Americans, the Hispanic population, Mexican-American population, so that if they say, I want to attend UNM and I'm going to make a commitment to staying here and practicing for a period of time, would we have a better chance of recruiting local people who have maybe relationships and commitment here versus someone who maybe comes from someplace else?
I know there are efforts in
okay, well, that's good to hear because I haven't heard.
The legislature and UNM has been working on this problem for 2 decades, and there is a BA/MD program at UNM Med School which mentors kids from rural areas, local areas, as a cohort as they go through their undergraduate into medical school. And that was supposed to, and we funded that from the legislature, okay. That was supposed to bring doctors back to rural areas. It's a drop in the bucket compared to the entire problem that we have. And I think that is one reason why they're trying to double the size of the medical school in New Mexico. The medical school here has been specializing in rural medicine, right. But it's just not enough in our state. Low income, chronic diseases, clearly. All of that. We need a all of the above approach, and MedMal is one. Licensure is one. Doubling the size of the medical school is another, and yet. The problem is a national one. Every year we try to do something, and this year we're trying to do more. We put in a $10,000 personal income tax credit to attract doctors.
No, we're trying anything that sticks. One other thing that I just read an article on this. Please, one of the unforeseen effects of this immigration crackdown is it's actually going to affect immigrant doctors who actually provide a lot of the health care in the United States. And it's going to affect us. And that's an unforeseen circumstance because they're going to be caught up in this. I have friends who are worried about the immigration issue as physicians, right? Sure. For their families, for their, and so on.
Yeah, we're pretty tight on time, but I do want to get to Clear Horizons. That was the legislation that would have codified the governor's climate goals over a period of decades. It did not pass. What does that mean, Dee Dee, in terms of those climate goals? They just remain in executive order. The governor's going to leave office. What happens to them?
Well, it's going to depend upon the next governor. And whether the next governor pushes these concerns about global warming and how New Mexico is a big contributor to it, that could be addressed by future executive orders, or could be addressed by a new legislature. But this was clearly a really big disappointment from this session. I was also disappointed that the ETA may be weakened because of these new Jupiter projects that have their own microgrids that are not subject to some of our limitations there. So this was a big deal, I think, the failure of that bill, and a blemish on what otherwise I think was a pretty successful session.
Understood. Thank you all. Oh, sorry, Mike, one
more
second.
Yeah, 1 second. I think, one of the things we need to begin to really, and are starting to, is that without clean air, clean land, and clean water, there is no life. And there are examples of what happened to uranium mining in New Mexico, northern New Mexico, with Navajo community and some of the Pueblo communities as well. And the fact that, there was expansion, uranium mining, people were put at risk, and those tailings are still have never, there's been never remediation of those sites. So we should look at that as an example of what we need to be considering with anything, any kind of development that impacts the planet, our land and our water.
Yeah. One other item that got through this session, it was a House resolution that passed unanimously, went into effect immediately, and it's the Zorro Ranch Investigative Subcommittee. It's called the Epstein Truth Commission, so-called. It's bipartisan members, all lawmakers. They're authorized to investigate allegations of crimes and corruptions at Epstein Zorro Ranch through the end of the year. According to House Democrats, lawmakers can issue subpoenas. They can potentially compensate victims with funds seized from Epstein's bank accounts. Eric, can they actually do those things?
Well, I'm not a lawyer, but my gut tells me that anything the courts and the judicial system can be to sort of empower folks to sort of get the sort of remedies that they need is going to be on the table. I think there's going to be, we have everybody from Congresswoman Stansberry to God bless Representative Andrew Romero, who just was fierce in this accountability. New Mexico sadly is coming up a lot in the Epstein files. This ranch is showing up a lot, and there was some pretty nefarious stuff going on there. From if I haven't read all of the Epstein files before, I've heard. So I'm really glad that we have some local leadership again modeling what should be happening all over this country, which is there has to be accountability. I don't think we're going to like all the names we see. Republicans and Democrats, I think it's going to be uncomfortable for everybody, but that's not the point. The point is to have real accountability for what was going on. But I think there's an opportunity for us to do what Washington should be doing.
Sure. Obviously, the public's been clamoring for action on this at the national level, state level too, obviously with the prevalence of New Mexico, as you mentioned. These are unpaid lawmakers, Dee Dee. Is it enough time? Is it enough? Will they have enough resources to do what needs to be done to?
I don't know what the budget was for this commission, but I'm impressed that they have subpoena power. I think that's a big deal, and that'll give it some teeth. I'm a little worried about how they would enforce any punishment against those that they. But the power of having hearings, the power of having this out in the public is important in terms of pushing Washington to do something as well. I think this is our moment to do that. I think this session has been a good one at, meeting the moment, the national moment when it comes to immigration, when it comes to the Epstein files. I think we've done it.
quickly, they cannot accuse people of crimes. I was just told that. I didn't quite realize, but they can investigate, of course. And Michael, to Dee Dee's point at the end there, given the distrust with the DOJ's handling of this situation, do our state lawmakers owe us anything more in terms of thoroughness, and the victims too?
Well, I'm in line with what Eric had to say. I think that, full disclosure, I mean, we need to know. We know how it's been handled at the Washington level. We do not want to reflect and mirror that approach. We want to do the right thing.
Right. Okay, thank you all.